If you take Amlodipine, Losartan, or Lisinopril every morning, and the main thing you know is that it lowers your blood pressure, let me ask you something very honestly. How sure are you that you would recognize the moment that medication stopped feeling routine and started sending you a warning? Because for a lot of seniors, that turning point does not arrive with flashing lights. It shows up as swollen ankles that seem harmless, a cough that gets blamed on weather, dizziness that gets brushed off as age, or weakness that feels too vague to mention. Before we begin, please subscribe to the channel, join our community, and stay with me for clear, practical health guidance. And stay with me to the end, because these next few minutes could help you spot a problem early instead of reacting late. I want to start with a woman named June. June was 76, organized, independent, and the kind of person who kept every test result in a folder by month and year. She took her medicines exactly as prescribed, never missed appointments, never played games with her health. But over one summer, 3 small things started happening. Her shoes felt tighter by late afternoon. She developed a dry cough that bothered her mostly at night. And twice in 1 week, when she stood up too fast from her recliner, she had to grab the wall. None of those symptoms felt dramatic by themselves. So she did what many careful people do. She explained them away. Maybe it was heat, maybe allergies, maybe she had just stood up too quickly. What she did not realize was that each symptom was pointing in a different medication direction. That is exactly why this conversation matters. Amlodipine, Losartan, and Lisinopril all treat high blood pressure, yes, but they do not behave the same way inside the body. And when people assume they are basically interchangeable, they miss the side effect patterns that could help them protect themselves much sooner. In this video, I'm going to walk you through 9 things seniors absolutely need to know if they take one of these medications. Not vague textbook talk, not complicated jargon. I mean the real-life, useful, practical details that help you know what is normal, what is not, what deserves a phone call, and what should never be ignored. If you take one of these medicines, or someone you love does, type the name in the comments. I always like to know who I'm talking with and what you're dealing with in real life. Number 1, these 3 medicines may share a goal, but they do not work the same way. And that one fact changes everything. Amlodipine is a calcium channel blocker. Its job is to relax the muscles in your blood vessel walls so blood can move through with less resistance. Lisinopril is an ACE inhibitor. It blocks a step in a hormone system that normally tells blood vessels to tighten. Losartan is an ARB. It works on that same blood pressure system too, but instead of blocking the enzyme, it blocks the receptor the hormone tries to act on. That may sound technical, but here is why it matters. Different mechanisms create different patterns. Different patterns create different side effects, and different side effects require different responses. If you treat them all like the same pill with a different label, you are much more likely to misread what your body is telling you. That is why one person on Amlodipine may deal with swelling, another on Lisinopril may deal with cough, and someone on Losartan may run into potassium issues or dehydration trouble without ever realizing the medication played a role. Your prescription bottle is not just a name, it is a clue. It tells you which set of problems to watch for and which symptoms deserve extra respect. Once you understand that, you stop thinking in generic terms like, it's just my blood pressure medicine. You start thinking much more precisely. This is Amlodipine, so I need to watch my legs and ankles. This is Lisinopril, so I need to pay attention to cough and swelling of the mouth or throat. This is Losartan, so I need to be careful about dehydration, potassium, and interactions. That shift alone can make you safer. Number 2, if you take Amlodipine, swelling in the ankles or feet is one of the most common things you need to watch. And a lot of people get frightened by it because they assume it means heart failure, failing kidneys, or severe fluid overload. Sometimes those conditions can cause swelling, yes, but Amlodipine has its own very specific way of creating that puffy, heavy, sock-mark swelling that creeps up later in the day. Here's the simple version. The medicine relaxes arteries very effectively, which helps lower pressure. But the veins do not relax in the same way. So blood flows into the lower legs more easily than it flows back out. Pressure builds in the tiny vessels, and fluid begins moving into the tissues around the ankles and feet. The result can be shoes that suddenly feel wrong, legs that feel full, and a body that feels unfamiliar by evening. Now here's the part I really want seniors to hear. The swelling may be common, but the wrong reaction to it is what causes trouble. Some people stop the medicine on their own because they get scared. Others start drinking less water because they think water is the problem. And both of those reactions can move you in the wrong direction. The better move is to report it. Bring it up. Ask whether the dose needs adjusting, whether the timing matters, whether another medication might fit your body better, or whether your doctor wants to look for another cause at the same time. You do not need to sit quietly for 3 months while your walking gets worse and your confidence drops. If you are on Amlodipine and you have ever noticed swelling by late afternoon, tell me in the comments. You are very likely not the only one. Number 3, if you take Lisinopril, a dry cough that seems random may not be random at all. And this is one of the most overlooked medication side effects in older adults because it can begin long after the prescription started. People expect side effects to show up the first week, but with Lisinopril, the cough may appear later and throw you off the trail completely. It is usually not a wet cough. It is more like an irritating, scratchy, persistent tickle that lingers in the background and seems worse when the house gets quiet. So people blame pollen, dust, reflux, a fan in the bedroom, or the cold they had 6 weeks ago. Meanwhile, the medicine keeps getting a free pass because nobody connects the timing. And what makes it frustrating is that cough drops, syrups, and throat remedies often do very little because the source of the problem is not in the cough drop aisle. I want to draw a sharp line here because in the Lisinopril family, there is also a symptom that is not a nuisance. It is an emergency. If you ever get swelling of the lips, tongue, mouth, or throat, especially if swallowing feels strange or breathing feels harder, that is not something to monitor overnight. That is something to treat like a real emergency right away. The dry cough and the dangerous swelling are not the same category, and seniors need that distinction burned into memory. One is bothersome and deserves a discussion. The other can become life-threatening if delayed. So if you are on Lisinopril, ask yourself 2 separate questions. Have I developed a stubborn dry cough that no longer makes sense? And have I ever had sudden swelling around my face or throat? Those are 2 very different answers, and they lead to 2 very different levels of urgency. Number 4, Losartan and Lisinopril can both create problems with potassium, and this catches people off guard because the danger often hides inside something marketed as healthy. Let that sink in for a second. A senior gets told to cut back on salt, goes to the store trying to do the right thing, and buys a salt substitute. Sounds responsible, right? But many salt substitutes use potassium instead of sodium. So now that person may be adding extra potassium to meals while taking a medication that can already push potassium upward. Add a supplement, an electrolyte powder, a recovery drink, or even a meal replacement shake, and the total load can creep higher than expected. High potassium does not always announce itself loudly. Sometimes it feels like muscle weakness, unusual fatigue, leg cramping, tingling, or a strange fluttering heartbeat. Sometimes there are barely any symptoms until the situation becomes much more serious. This is one of those moments where good intentions can create quiet risk. And that is why I always tell seniors not to think only in terms of prescription bottles. Think in terms of the whole environment around the medicine. What are you sprinkling on your food? What powders are you mixing in water? What heart-healthy products did you buy because the label sounded smart? If you take Losartan or Lisinopril, it is worth bringing your supplements, salt substitute, and drink mixes into the conversation with your doctor or pharmacist. Don't assume they are harmless because they sit on a grocery shelf instead of behind a pharmacy counter. Your heart and kidneys do not care where the product was sold. They care what chemicals entered your body and how those chemicals interact with the medication you take every single day. Number 5, illness changes the rules. If you take Losartan or Lisinopril and you get dehydrated, the medication that normally helps you can suddenly hit your body very differently. And this is one of the least discussed but most practical things seniors should know. A stomach bug, vomiting, diarrhea, Fever, poor appetite, heavy sweating, or even a few hot days with low fluid intake can change your internal balance fast. Blood pressure can drop lower than expected. Dizziness can become stronger. The kidneys can become more vulnerable. The exact same dose that felt fine when you were well can become too much when your body is losing fluid. The medicine did not become bad. Your condition changed. But if nobody has ever explained that to you, you may keep taking everything exactly the same while your body is working under very different circumstances. That is why every senior on these medications should have what I call a sick day plan. Not a vague idea, a real plan. A plan that answers simple questions before you actually need the answers. If I cannot keep fluids down, should I still take my usual dose? If I have had diarrhea all day, when do I call? If I feel faint after vomiting, what matters most? Those are not dramatic questions. They are smart questions. And surprisingly, few people ask them until they are already sitting at home feeling weak and trying to guess. I want you to remember this line. Illness changes the operating conditions. If your doctor has never given you clear advice about what to do with your blood pressure medicine during dehydration or stomach illness, put that on your list for the next appointment. It is one of the most protective conversations you can have. Number 6, one of the easiest ways to accidentally strain your kidneys is by combining these medications with common over-the-counter pain relievers. And this is where people get into trouble because the products feel ordinary. You have knee pain, back pain, shoulder pain, arthritis, maybe a dental issue, and you reach for ibuprofen or naproxen because that is what people have done for years. It feels simple, it feels familiar, but when medicines like Lisinopril or Losartan are in the picture, and especially if a water pill is also involved, those pain relievers can increase the risk of kidney stress, low blood pressure, and sometimes a very bad combination when dehydration is added on top. This does not mean every single dose automatically creates disaster. It means the combination deserves respect, not casual use, especially in older adults whose kidneys already have less room for error. And here's what makes this so frustrating. Many seniors never mention the pain reliever because they do not think of it as part of their medication list. They will bring in their prescriptions, but not the bottle from the drugstore. Meanwhile, the doctor is looking at one picture and the kidneys are living in another. If you routinely use anti-inflammatory pain pills and you also take Lisinopril or Losartan, have that conversation directly. Ask what is safest for you. Ask whether acetaminophen, a topical option, physical therapy, heat, stretching, or another plan would reduce risk. The goal is not to leave you suffering. The goal is to stop treating over-the-counter choices like they are invisible. They are not invisible. They are chemistry. And when that chemistry collides with dehydration, age, kidney vulnerability, and blood pressure medication, small habits can create bigger consequences than people expect. Number 7, dizziness when standing up is not something seniors should normalize just because it passes quickly. And I know how often this gets dismissed. I just got up too fast. It only lasts a second. That happens to everybody at my age. But a 1-second wave of lightheadedness is long enough to cause a fall. And once a fall enters the story, the conversation is no longer about a tiny symptom. It is about broken bones, fear of walking, reduced independence, rehab, and the kind of health setback that can change a year of someone's life. Blood pressure medicines can contribute to this because when you stand, gravity shifts blood downward and your body has to compensate. If the adjustment is slower, or if the medication is lowering pressure a little too effectively for that moment, you can feel the room tilt, dim, or sway before your body catches up. That means the solution is not only be careful, the solution is specific. Sit at the edge of the bed for a moment before standing. Pause when you rise from the couch. Hold something sturdy if mornings are rough. Notice whether the dizziness is worse after a hot shower, on an empty stomach, during illness, or after missing fluids. And most importantly, if it keeps happening, say so. A recurring pattern of dizziness is useful medical information. It may mean the dose is too strong, the timing needs adjusting, another medication is adding to the effect, or you need a closer look at hydration and home readings. Please don't let embarrassment keep this one quiet. A senior who admits, I get a little dizzy when I stand up, maybe preventing a far more serious event later. That one sentence can matter much more than it sounds. Number 8, a single home blood pressure reading can mislead you badly if you do not measure correctly or if you react to isolated numbers instead of patterns. And this is where anxiety causes people to make shaky decisions. One morning, the number is higher than you wanted, and suddenly you think the medicine has stopped working. Another evening, the number is lower than usual, and now you wonder if the dose is too strong. But blood pressure is not a fixed personality trait. It moves. It responds to stress, caffeine, pain, poor sleep, exercise, conversation, temperature, a full bladder, and even the fact that you are worried about the reading itself. If you build your decisions around one number taken in a rushed moment, you can frighten yourself for no reason or miss a real trend because you are chasing snapshots instead of the bigger picture. So let's make this practical. If you monitor at home, use an upper arm cuff, not a finger gadget you bought because it looked convenient. Sit quietly for 5 minutes first. Don't measure over clothing. Keep your back supported, feet flat, arm at heart level, and try not to talk while it is running. Avoid caffeine, smoking, and exercise right beforehand. Then take 2 readings about a minute apart and write them down. That sounds basic, but the details matter because sloppy technique creates sloppy information, and sloppy information leads to poor decisions. The goal is not to collect dramatic numbers. The goal is to collect reliable numbers. Reliable readings help your doctor see patterns over time, and patterns are what guide treatment. If you check at home, tell me below. Do you keep a written log, or do you mostly rely on memory? Here's the other thing seniors need to know about home numbers. If you get one high reading, that does not automatically mean you are in immediate danger. And it also does not mean you should take extra pills on your own. Recheck it. Rest. Look for context. Were you upset? In pain? Rushing? Did you just walk in from outside? On the other hand, if readings are extremely high and you also have symptoms like chest pain, shortness of breath, trouble speaking, weakness, severe headache, or vision changes, that becomes a very different conversation and should be treated urgently. The same is true if a reading is extremely low and you feel faint, confused, or unstable. Home monitoring is powerful when it is used calmly and correctly. It becomes a problem when people use it like a panic button. You want data, not drama. Calm patterns tell a much truer story than fear ever will. Number 9, these medications only help when they are taken consistently, followed properly, and supported with the right follow-up. And this is where a lot of preventable trouble begins. Amlodipine, Losartan, and Lisinopril are not rescue medicines. They are not meant to be used emotionally, like taking an extra dose because one number scared you, or skipping a dose because today's reading looked good. They work best through steady presence, day after day, with your body adjusting around that consistency. When the schedule becomes erratic, it gets much harder to know whether the medication is failing, whether side effects are developing, or whether the problem is simply the pattern of use. Missed doses, double doses, sudden stopping, and wildly inconsistent timing can create confusion for the patient and the clinician at the exact same time. And follow-up matters more than many people realize. For Losartan and Lisinopril especially, blood tests are not some optional extra your doctor orders just to be thorough. They help check kidney function and potassium, which is part of safe long-term use. If you start the medication, change the dose, add a new medicine, get dehydrated, or begin using supplements regularly, those details can matter. So when your doctor says, "I want labs," hear that as part of the treatment, not a side errand. Also know the basic missed dose rule people are often told. If you remember fairly soon, take it. If it is almost time for the next dose, skip the missed one and return to schedule. But your own prescriber's instructions should always win. Write them down. Keep them with your medicines. Guessing is not a strategy. Let me give you another real-life picture of how this all plays out. A man in his 70s starts Amlodipine and notices his socks leaving deep marks. He says nothing. A few months later, he walks less because his legs feel heavy. Around the same time, he begins using ibuprofen most nights for hip pain. And during a stomach bug, he keeps taking everything normally because nobody ever explained what dehydration could do. That is how small misunderstandings start stacking, not through recklessness, through silence, assumptions, and the very human habit of thinking it's probably nothing. Then, by the time he feels weak, dizzy, and frustrated, the story sounds much more complicated than it really is. Often what looked mysterious was actually a chain of predictable medication-related events that nobody stopped early because nobody named them early. That is the theme I want to keep bringing you back to. These medications are helpful. They protect a lot of people from strokes, heart strain, and long-term damage. But they are not background noise. They are active drugs with recognizable patterns, and seniors do best when they learn those patterns instead of taking the pills on autopilot. Not because I want you anxious. The opposite. I want you less anxious. Specific knowledge usually reduces fear because it replaces vague dread with useful observation. When you know what swelling on amlodipine tends to look like, you panic less and report more clearly. When you know lisinopril cough can start later, you stop chasing random explanations forever. When you know salt substitutes can matter on Losartan, you stop assuming every healthy swap is automatically safe. Clarity makes people calmer and smarter at the same time. Now I want to talk about what should trigger a call soon and what should trigger help right now. Because not every symptom belongs in the same bucket. If you have ankle swelling on amlodipine that is new, worsening, or interfering with walking, that deserves a conversation. If you have a dry cough on lisinopril that lingers and makes sleep miserable, bring it up. If you feel more dizzy than usual, if your home readings suddenly look different over days instead of minutes, if you have been sick and cannot stay hydrated, if you are using NSAIDs regularly, or if muscle weakness and palpitations show up while taking Losartan or lisinopril, those are good reasons to contact your doctor promptly. These are not overreactions. They are exactly the kind of early check-ins that keep small problems from becoming larger ones. But there are also symptoms that should push you out of wait-and-see mode immediately. Swelling of the tongue, lips, throat, or face, especially with trouble swallowing or breathing, is emergency territory. Very high blood pressure with symptoms like chest pain, shortness of breath, weakness, numbness, severe headache, vision change, or trouble speaking is emergency territory. Fainting is not something to casually monitor for next week. Severe dizziness with inability to stand, chest discomfort, or an irregular pounding heartbeat that feels new and frightening deserves urgent attention. Seniors sometimes underreact because they do not want to be a bother. Please hear me clearly on this. Emergency symptoms do not become less serious because you are polite. You are allowed to act quickly when the situation calls for it. In fact, that is exactly what wisdom looks like. There is another truth here that people do not say often enough. A blood pressure medication is not successful just because the numbers on paper improved. And that matters. If a medication lowers your pressure but leaves you swollen, exhausted, afraid to stand, coughing through the night, or confused about what you can safely eat or take with it, then the treatment plan still needs work. Good care is not just about reaching a target, it is about reaching that target in a way your actual life can tolerate. Seniors deserve treatment they can live with, not just treatment that looks good in a chart. That means symptoms matter, side effects matter, your daily function matters, your ability to walk, sleep, think clearly, and feel safe in your own home matters. Those are not secondary issues. They are part of whether the medication is truly working for you. And please do not underestimate the danger of silent suffering. When people endure side effects quietly for too long, one of two things often happens. Either quality of life slowly shrinks, or they eventually stop the medicine on their own out of frustration. Then blood pressure rises, the doctor thinks the plan failed, and everyone is trying to solve the wrong problem because the missing piece was never spoken aloud. Your doctor cannot respond to symptoms you never mention. Your pharmacist cannot warn you about combinations you never disclose. And your family cannot help you notice patterns if they do not know what to look for. Speaking up is not complaining. It is participating. It is what turns a prescription into a real treatment plan instead of a silent experiment. If nobody has ever told you that before, let me be the one who does. Your observations are medically valuable. So let's bring all 9 points together in the simplest way possible. Number 1, These 3 drugs are not interchangeable in how they work or what they tend to cause. Number 2, amlodipine often brings ankle and foot swelling that should be reported, not hidden. Number 3, lisinopril can cause a stubborn, dry cough, while swelling of the lips, tongue, or throat is an emergency. Number 4, losartan and lisinopril can make potassium issues more likely, especially when salt substitutes or supplements quietly add more. Number 5, dehydration from illness or heat changes how these medicines affect you, so every senior needs a sick day plan. Number 6, common pain relievers like ibuprofen and naproxen can become risky partners, especially for kidneys. Number 7, standing dizziness is a fall warning, not a personality quirk. Number 8, home readings matter most when technique is good and patterns guide the conversation. Number 9, consistency, follow-up, and lab work are part of safe treatment.